Thank you all for joining tonight's presentation on men's health, the signs, symptoms, and treatment options for erectile dysfunction.
We hope to kind of go over what is erectile dysfunction, who has it, how common it is, and what causes it. So it is the persistent inability to achieve or maintain an erection that's firm enough to have intercourse. How common is it? It's very common. So about half of men over the age of 40 will have some degree of erectile dysfunction. This affects nearly 40 million American men each year. How does an erection work? Well, with arousal, the nerves surrounding the penis become activated. This creates increased blood flow into the arteries and they relax, creating more blood flow into the penis. As the penis becomes more hard or rigid, the valves in the veins get pushed off and you have a tight, erect penis. And then it maintains erection through continued stimulation. So why do men get erectile dysfunction? The vast majority or the most common cause is problems with the arteries that go to the penis or vascular problems. Diabetes is also really associated with erectile dysfunction, and some medications also can cause or lead to erectile dysfunction. It can be a result of some of the things we do in urology, like treatment of prostate or bladder cancer. It's also highly associated with problems with the heart and diabetes. Erectile dysfunction doesn't just affect the penis, it can really impact a man's quality of life, whether that's their mental health, their relationships, how they perceive themselves, and their self-esteem, as well as all of these other things that we mentioned here in this diagram. So let's talk about the options for treating erectile dysfunction. That's what we all want to know. There's a lot out there on the internet. We're going to kind of just go through the most common treatments and sort of stepwise go through each one. We'll start with oral medications. They're often called PDE5 inhibitors, and they work by increasing blood flow to the penis. I tell patients, it's not an elevator button. You don't just take a pill and then you get an erection. You have to still have the same romance, the same stimulation, and it simply increases the blood flow that you're already sending to the penis. Usually have to take it about 1 hour before anticipated sexual activity, and they work usually around 4 hours. You can only take them once a day, and you can have different effects of the medication depending on how full your stomach is. They're effective in about 60 to 80% of the cases. So we know that men that have had prostate cancer surgery, about half of men give up on these oral medications because they're just not working well. We also know that men with diabetes are about 2 times more likely to move on to needing other additional treatments. But this is a good first step for mild to moderate erectile dysfunction. The common side effects I tell patients about: headache, flushing, stuffy nose, upset stomach, some color vision changes. And it's really important that you talk to a doctor before starting these medications. There are a lot out there. You can find them online in different places, but you really want to be managed by a physician, either a primary care or urologist, and they need to make sure that you don't have any heart conditions that would make it potentially dangerous before taking these medications. The next option is a vacuum erectile device. You can see this picture on the right side of the screen. That's a historic picture. They've been doing this for a long time. The technology's changed maybe a little bit, and it works by placing a hollow plastic tube over the penis, sucking out the air, which pulls blood into the penis. You then have to place a constrictive band or at the base of the penis, and that will maintain the blood that's already been pulled into the penis. Satisfaction rates, at least initially, are 68 to 80%. But despite this high initial success rate, a lot of people decide to move on to other sexual aids. The main reason are the common side effects that are also the same reason for why they're discontinued. They tend to block ejaculation because you have that ring or band around the base of the penis. There's bruising with the penis, you can have penile discomfort and numbness or coldness. So these are some of the same reasons why men discontinue them: the bruising, lack of spontaneity, difficulty with making sure the pump is working right or getting the band on just right, and they're not the most natural feeling erections. So moving on to urethral suppositories. This is commonly known as Muse, and this works by placing the medication directly into the urethra. We would teach you how to do this before starting this medication, and the onset for this medicine usually takes 5 to 10 minutes. You have to keep this medicine in the refrigerator, and it works by basically dispersing the medicine into the local tissues through the urethra. Success rates are about 50%, and most men don't continue using this form of erectile dysfunction treatment due to the following side effects: pain in the penis, or the urethra, or the testicles. You can have some burning type pain, especially with urination, low blood pressure, dizziness, and people discontinue it, like I said, mostly because of insufficient erections suitable for intercourse, or the urethral pain or burning. Moving on to a highly effective treatment is called intracavernosal injection therapy. This is a medicine that's injected into the side of the penis, directly into the erectile bodies, or the tunica albuginea. A common name is alprostadil or Caverject. There's a formulation called Trimix or Quadmix. This is a common medication that urologists teach men how to do, or their partners can also learn how to do this. Often when I'm telling a patient that you can inject a medication into the side of the penis, their eyes get really big. But it's not that bad. You will learn how to do this in clinic, and the needle is really, really small. For the men with diabetes, they know what a diabetic needle is. It's the same concept. So how effective is it? About 60% of patients are satisfied in continued use. But, initial success rates are pretty high, but in a study that looked at over 254 men, only about 20% continued this therapy long term. The injection site can often be painful. You can develop scar tissue through prolonged use within the penis or the skin itself. One side effect is priapism, or prolonged erection lasting longer than 4 hours. And then you can get some bruising or blood collection underneath the skin injection site. So men discontinue this, we know, because of their erections no longer are firm enough for penetration, they have penile pain, or they just stop liking, or they've never even liked doing the injections to begin with. So moving on to penile implants. A penile implant is a surgically implanted device. It has 3 main components: the cylinders, which are implanted into the penis, a pump that's inside the scrotum, and then a reservoir of saline or salt water that goes behind the pubic bone in the lower abdomen. They work by squeezing and releasing the pump that's located in the scrotum. That moves fluid from the reservoir into the cylinders, creating an erection. You then deflate the device when you no longer want the erection by pressing the deflate button within the pump. We will show you a video here shortly about how this works. So we've been talking about how effective each medication is, or each treatment is, and then how satisfied patients are. So I want you to look at these numbers. 98% of patients reported erections to be excellent or satisfactory with a penile implant. After 7 years of having an implant, 94% of men are still using it, and they haven't had it or needed any revision surgeries. The most common side effects, complications, reasons for removing the device include genital pain, mechanical malfunction. It is a device with moving parts, and sometimes it can have this problem called autoinflation, very rare. Infection would require removal of the device, and sometimes you need to repeat the surgery when the device stops working. So this is a picture of the actual device. This is what it looks like. This is the AMS 700 from Boston Scientific. It's the only implant that's available with this special antibiotic impregnated surface. It's FDA approved and it's proven to reduce the risk of infection. You say, how common are the infections? We'll get to that a little bit later, but it's less than 3%. I'm going to start this video. This is from Boston Scientific, and it's kind of a cartoon animation that shows exactly how this device works. So once it's implanted and you've healed from the surgery, we teach you how to use this device. Everything is concealed, so no one knows you have it. And you're taught how to squeeze the pump that's located in the scrotum. This moves fluid from the reservoir into the cylinders, creating an erection. When you're no longer in need of the erection, you simply deflate the device by pressing the button. That decreases the fluid or moves it from the cylinders back into the reservoir. The penis then returns to a soft, kind of flaccid, natural-looking state. That video is available online, YouTube, Boston Scientific. I also have a copy of it if you want to watch that again. I know we went through that kind of quickly. So not only patients, but also their partners. It's important to talk about the partner satisfaction with any of these type of treatments for erectile dysfunction. So we know that men are really satisfied. 97% are satisfied with their erections. And then their partners are also very satisfied. 96% are satisfied with their partner's penile implant. And they rate it as either excellent or satisfactory. So the benefits of doing these penile implant surgeries is that it's a permanent solution to erectile dysfunction. It brings back a lot of the spontaneity of sex with your partner. So you no longer have to go over to the refrigerator, get the medication, get the needle out, get the suppository. Remember to take the pill on an empty stomach 1 hour before. This really brings you back to, okay, it's go time. Well, we can get you an erection anytime. And it also lasts as long as you want it to last. It only goes down when you want it to go down and you press the button. So it's entirely contained inside the body. You go to the gym and when it's not COVID, and nobody's going to be able to tell if you're in the locker room that you have this penile implant. All the incisions are very small and nobody's going to be able to tell. So we went over the high patient and partner satisfaction, which is key with this. And, as far as men often will ask, is my penis going to feel the same? Am I going to have the same orgasm or ejaculation? And absolutely. The sensation along the penile skin does not change. You should still be able to ejaculate the same, and orgasms are maintained. We're not doing anything with the mechanics of all of those. Lastly, implants have been around for a long time, over 40 years. Almost 500,000 men have had a Boston Scientific penile implant. A quick word on insurance coverage. Most insurances, and especially Medicare, they do cover penile implants. It's going to be a little bit specific depending on your specific coverage, but our office can work with, and they always do prior authorizations to let you know as far as deductibles, out-of-pocket costs, and does your insurance actually cover this device. I don't want to let insurance coverage totally dictate whether or not you're able to have an implant, and there are some financial assistance programs out there, and we can give you more information on a patient-per-patient basis. So just like all of the other risks that we talked about with the other medications and treatments for erectile dysfunction, surgery is surgery. And so you have to kind of know what you're getting into before signing up for any surgery, including a penile implant surgery. So risks that are associated with penile implant. So as far as the infection risk that we talked about before, it's 1 to 2.5%. And these infection risks do go up if you have diabetes, spinal cord injury, or any kind of open sores within the scrotum or penis. Some reasons why we may have to remove the implant would be something like pain, but pain is usually only a few days to a few weeks after this surgery. There is mechanical failure. Most men get at least 10 years out of one device. But if it does stop working for any reason, then we can simply remove the old device and place a new one in the same place. This first bullet point, I know I'm working backwards, but it is important to know that once we go through with a penile implant surgery, you can't go back to the other treatments of ED. So you won't be able to remove the device and then go back to using pills or the medications that are injected into the penis due to what this surgery does by placing these into the erectile bodies. So in summary, thank you so much for your attention. Erectile dysfunction is very common, and it's associated with other medical conditions that we went over. There are a variety of treatment options. We offer anything that we mentioned today. We can talk about any of these going from pills all the way up to penile surgery. The benefits that we talked about with penile implants, it really does offer a permanent, lasting solution. I encourage you, if your partners aren't on this webinar, but to talk to them. I have more resources on my website, as well as edcure.org has a ton of website. That's Boston Scientific's erectile dysfunction website. So I encourage you to look at those, look at our Urology Nevada website, and then I'd love to see you in clinic or talk to you about this in the future.